The other thing is that if you have original Medicare and you want to get insurance, you can purchase a Medigap or a Medicare supplement. Those are also standardized plans, and they have varying levels of coverage. The most popular plan right now is the F plan, which covers most things people have to pay out of their pocket for Part A and B. But Medigap plans cost an average of between $150 and $250 a month, and as you age, those premiums go up and up. There are people in there. I saw one bill for an 85-year-old woman was $550 a month for a Plan F, and she had been on this plan for 15 years or whatever. But the cost that represents, if you have original Medicare and you purchase a Medigap, you're probably going to have the highest out-of-pocket, the highest cost for that coverage. Now, if you have a lot of medical care needs, that may be your best choice, even though you're paying monthly for all these premiums. If you're not paying co-pays, which you have under HMOs, it may actually be a better choice. Plus, you get to go to whoever you want. You're not confined to going to a provider that the HMO has contracted with. So there are benefits, there are costs and benefits to both. Most people choose HMO because it has the lowest immediate out-of-pocket costs. There are HMO plans that have zero premium. You don't pay a premium at all. Those are the plans like Secure Horizons Plan 1 that you don't get to go to Sharp or Scripps Clinic. You have to go to Mercy, Physicians Group, or some of the other lesser known providers. But if you pay $59 a month for Secure Horizons Premium Plan, whatever they call it, then you get to go to Scripps Clinic or Sharp, Steely or whatever. So those are sort of how they mitigate the cost. But in general, HMOs are going to be the lowest out-of-pocket cost on average. The next highest cost would be for a PPO, which a PPO is going to have more cost sharing for every time you go use the healthcare system. Whereas an HMO, you'll pay $20 or $30 co-pays every time you see the doctor. You might have no co-pays for lab tests. You might pay, co-pay for the first 10 days in a hospital or a nursing home. But other plans will, a PPO plan will charge you a percentage usually as a co-pay. There'll be a co-pay, but there will also be a percentage if you use laboratories or other, if you use other services. So you have to actually sit down and figure out under which scheme are you going to do better. If you have a PPO, the only advantage is, one, you don't have to go to your primary care physician to go see a specialist. You can just walk out to the wide array of network specialists and make an appointment. Whereas in an HMO, you have to go through that one primary care physician. He or she has to authorize every, they have to refer you. They sort of control everything that happens. With a PPO, you have a little bit more freedom. And with a PPO, if you really want to have a lot of freedom, let's say you want to go to the Cleveland Clinic instead of Green Hospital to have your bypass, you can go and do that with a PPO. You're going to pay about 30% higher cost if you choose to do that, because assuming that that's out of the network, you're going to pay about a 30% premium. But if the PPO networks here are fairly extensive. The HealthNet one, and even the Blue Cross when it was available, they included many of the major hospitals, major providers. It was very easy. It's very easy to get some kind of service from a wide array of different providers. When you get into HMOs, you're always going through the primary care physician. Everything has to be approved. The other thing is with a PPO and HMO, if you travel and you are out, with an HMO, if you travel and you're outside of San Diego County, you have to call, if you need medical attention, you have to call that HMO within 48 hours, unless it's an emergency, in which case it has to be a true emergency for you not to notify them. But you have to get their permission, basically, for them to pay for your emergency care if you're out of your network geographic areas.